And go.
Nurse Christy is a registered nurse looking over her chart to see who to delegate the assignments to. A UAP or unlicensed assistant personnel is responsible to perform activities such as ADLs, for example, feeding, drinking, ambulating, turning, grooming, toileting, dressing, collecting data such as vital signs and weights, collecting simple specimens such as stool or urine, transporting patients, restocking, clerical activities, housekeeping tasks. However, according to the American Nursing Association, the registered nurse needs to remember to assess 6 risk factors before permitting a UAP to perform a task. The 6 risk factors include: what is the potential for harm? What is the condition or stability status of the patient? What is the complexity of the activity? Is there a potential for problem solving or innovation? Can the predictability of the outcome be determined? What level of interaction with the patient is needed for a positive outcome? Good morning.
Good morning.
Morning. How are you guys doing? Good. Okay, Jasmine, today you're going to be taking vital signs for Miss Smith, Mr. Johnson, Mr. Hernandez, and Miss Martinez. Okay, and Dennis, I'd like you to do wound care for Miss Smith because she's post-operative. I'd like you to help with ambulation for Mr. Johnson, so you both can do that together. Miss Hernandez just needs to be turned because he's a mobile patient, so Jasmine, you can handle that. And then Miss Martinez just needs a bed bath, and if she's too swamped, then you can do that. Okay? Does that sound good?
Sounds good.
Practical nurse. According to the National Federation of Practical Nurse, duties may include taking and recording temperature, blood pressure, pulse and respiration rate, dressing wounds, observing patients and reporting adverse reactions or altered conditions, administering medications, noting time and amount on patients' charts, assembling and using such equipment as catheters, tracheotomy tubes, oxygen supplies, recording food and fluid intake and output, applying compresses, hot and cold packs, bathing, dressing and assisting patients in walking and turning, performing normal range of motion exercises with patients, collecting routine laboratory specimen, starting and checking on 4 equipment.
Yeah. Good morning, Ms. Smith. How are you today? I'm okay. I'm gonna be your UAP today. My name is Jasmine. I'm coming in to take your vital signs, if that's okay with you. Yes. Okay, perfect. Go ahead. So I'm gonna go ahead and get the LPN so he can assist me to ambulate you, okay? I'll be right back.
Back in a couple of minutes, okay?
Oh, Dennis, hey, I was looking for you. I have a patient room 305 that needs to use the restroom.
Okay.
Is it okay if you can help me transfer her?
Of course.
Thank you. Hi, Mrs. Smith. I'm coming to take you to the restroom.
Good morning, Miss Smith.
Hello. And this is Dennis, the LPN is going to assist me to transfer you, okay? Okay.
Let's just story you a little bit more, just to make sure. Okay, perfect. Alright, so we're going to place you in this protocol. It'll be a lot easier. So cover you. Are you good with yourself? Can you move? Or you need more help? Help here. Just hold
Please
on.
put your feet first on the floor.
Here you go. You got it. Gotta go down. There you go. One turn.
So we're gonna step out. If you need anything, you can give us a call and just ring the bell, okay?
Here's your call light, okay?
Okay, thank you. Hi, Miss Smith. I just noticed your call light. Do you need assistance? Are you finished?
Yes, I'm done.
Okay, I'm gonna go ahead and take you out of try to treat it.
Don't worry, Miss Miss again. Okay. Let's just move you back here. Can you put your legs on the forehead? There you go. Let's just rotate you a little. Jasmine, your is going to hold you up, raising your legs. Okay. So I'm here. I'm just going to assess your wound already.
Okay.
Do you have any pain?
Yes, I'm in a lot of pain.
Oh, you are? And a scale from 0 to 10, 10 being the most, how much pain are you?
10.
10? Oh, wow. Okay. Just give me a second. Let me go ahead and get your nurse so she can check if there's any orders in your chart, okay?
Okay, thank you.
I'll be right back.
Thank you.
Hey, Christine.
Hi, Davis. How are you doing?
I just want to assist patient Smith
Uh-huh.
room 305
Uh-huh.
to do her wound change.
Yes.
But she said she was in a lot of pain. When I asked her a scale, she said 10 out of 10. I don't know if you want to check it out before I do anything.
Okay, great. Let me just look at her chart real quick and I'll be right in there.
Perfect.
Thank you.
Yes.
Hi, Mrs. Smith. I am your nurse. My name is Christy. I heard that you were having a lot of pain.
Yes, I'm having a lot of pain.
Okay, on a scale of 0 to 10, 10 being the worst, 0 being none at all, what do you think your pain is?
10.
A 10, okay. What do you think caused it?
It's my wound. I feel like a throbbing feeling,
Okay,
and it's very discomforting.
and it's just regionalized, right where your wound's at? Or
Yes.
is it? Okay. All right, great. Well, I'm just going to take a look at that real quick, okay? Great, so I'm going to move you up to a comfortable working position. And then I'm going to check that out for you, all right?
Okay.
Go.
Okay, almost there. I'm just going to move you up just a little bit more, okay?
Okay.
Alright, great. Alright, I'm going to lower this. I'm going to grab some gloves real quick. Do you need help turning on your side? Or do you think you can handle it? Okay, great. If you could just turn facing that way for me, please, while I assess your wound.
According to the American Nurse Association, a registered nurse duties include perform physical exams and health histories, provide health promotion, counseling, and education, administer medications, wound care, and numerous other personalized interventions, interpret patient information, and make critical decisions about needed actions, coordinate care in collaboration with a wide array of healthcare professionals, direct and supervise care delivered by other healthcare personnel like LPNs and nurse aides, and conduct research in support of improved practice and patient outcomes.
Okay, it does look like your wound is a little bit inflamed, and I did notice that you took Tylenol about an hour ago, and it doesn't seem like it's helping the pain at all, so I'm going to call the nurse practitioner and see what she recommends, okay? And I will be back as soon as I get a new prescription for you. Okay, I'll see you in a few minutes, okay? Thanks. Hi, Maria.
Hello.
I have a patient in 305, Miss Smith. She is complaining of a 10 out of 10 pain.
Okay.
The LPN was going in to address her wound, which is when she complained of the 10 out of 10 pain.
Okay.
I assessed it, and it does look like it's a little inflamed. She's post-operative.
Okay.
My recommendation is upping her pain medication to morphine or something of that genre.
No, let's not do morphine because it might give you like nausea and dizziness.
Okay.
Let's do Percocet.
Okay.
So it'll be oxycodone 2.5 milligrams and acetaminophen 325 milligrams PO.
Okay. As needed?
Let's do as needed, but assess her pain level 30 minutes after and see if she has any other symptoms.
Okay.
Yeah, and also check her blood pressure because it tends to
Okay.
affect that.
Sounds like a plan.
Okay,
Thank you very
thank you.
much.
According to the Nurse Practice Act, the Advanced Registered Nurse Practitioner may perform acts of nursing diagnosis and nursing treatment of alteration of health status. The Advanced Registered Nurse Practitioner may also perform acts of medical diagnosis and treatment, prescription, and operation, which are identified and approved by the Joint Committee. Due to recent changes in Florida legislation, advanced practical nurses can prescribe DEA-regulated medications.